In a completely unstartling turn of events that everybody with half a brain and a vague vapor of independent thought in their heads knows already, science now confirms that physical activity could have helped stave off COVID deaths. Good thing these people closed all the gyms to save some lives. You know, they tried to sneak this one out into the media wasteland that exists between Christmas and New Year's. Let me show you. It will probably shock none of you. It's what normal people with a couple of brain cells to rub together have known all along and have been saying since the very beginning of the pandemic. It's a recent study published in the American Journal of Preventative Medicine. Take a look. A retrospective cohort study of Kaiser Permanente, Southern California adult patients who had a positive COVID-19 diagnosis between January 1st, 2020 and May 31st, 2021 was created. The exposure was the median of at least 3 physical activity self-reporting groups before diagnosis. Patients were categorized as follows. Always inactive, so less than 10 minutes of physical activity per week. A median of 60 to 50 minutes per week, so that would be the consistently active group, and then an always active group, so in excess of 150 minutes per week. Outcomes were labeled as hospitalization, deterioration event, or death 90 days after COVID-19 diagnosis. I bet you guys know exactly where this is going. Of 194,191 adults with COVID-19 infection in the study, 6.3% were hospitalized, 3.1% experienced a deterioration event, and 2.8% died within 90 days. Dose response effects were strong. For example, patients in the some activity category had higher odds of hospitalization, deterioration, or death. If you look at the data here, 95% of those who died of COVID-19 were in the lower activity level. Here's the interesting part. Results were generally consistent across sex, race, and ethnicity, age, and BMI categories, and for patients with cardiovascular disease and hypertension. That last part is really interesting because it means that even if you had a pre-existing condition, if you were active before your COVID diagnosis, it became a prophylactic against any sort of severe COVID outcome. Yeah, we all knew this. You know, because being physically active is generally good for you. It staves off all manner of diseases like heart disease, diabetes, its sister, insulin resistance, Alzheimer's, arthritis, other inflammatory diseases, kidney disease, neuropathy. And of course, this was all evidenced in the data of COVID deaths and hospitalizations themselves. If you looked at the comorbidities associated with people who became severely ill or hospitalized or even sadly dead from COVID, age, of course, was the first factor. But then it was lifestyle-related illnesses and issues like heart disease, diabetes, obesity. All things that could have been addressed without a vaccine mandate, business closures, and travel restrictions, but rather with some good old reliable exercise, physical activity, and of course, a proper human diet. But the advice from our public health necromancers, and I continue to call them that because they use the dead to control the actions of the living, well, they closed the gyms. They ruined the businesses of gym owners and personal trainers, and they did this, of course, all for your health, to stop the spread of COVID, to protect the healthcare system. Early in the pandemic, these same people were roping off playgrounds and public parks and telling everybody to stay inside. At one point, they even closed the national park next door to me, so that even if your gym was closed, you couldn't even walk around in nature, or in my case, run around in nature, or snowshoe around in nature, depending on the season. These same people canceled organized kids sports and school sports and gym class, and then they forced children to sit behind a computer all day and stay at home for school. Again, all for their health. They told you to stay at home, Netflix and chill, and Uber Eats yourself into an early grave. The pandemic weight gain, it became a very real thing that people are still dealing with now and will, of course, cause health fallout for an already strained healthcare system. And if you questioned any of this bad advice, you became the dangerous, unscientific lunatic who didn't care about their neighbor. People died because they followed the advice of these so-called medical professionals to sit at home and do nothing, and no one will ever be held accountable for any of it. For Rebel News, I'm Sheila Gunn-Reid. Might I suggest you start the new year off right by treating yourself to a Rebel News Plus subscription. It's only $8 a month and it gets you early, ad-free access to all of our paywalled content. Just go to rebelnewsplus.com to join today.